Hi everyone, it's Nilanjana coming to you with a video on IBS, irritable bowel syndrome. So the patient usually is at the younger end of the spectrum, and by the younger end of the spectrum, I mean in their early 20s and up to about 60s or 65-ish. So this is the range of the ages of people presenting with IBS type symptoms. Now, what do I mean when I say IBS type symptoms? They are either getting random bowel movements, they're either getting ongoing diarrhea or they're getting ongoing constipation. They are also quite frequently getting abdominal cramps, which can be quite distressing, and they are having to miss work or they're missing school, etc. etc. I look upon IBS as an expression of the bowel, and this expression is about the condition of the mind. So if you're stressed, you're nervous, your bowel then expresses that stress or that anxiety in its own way. Say, for example, you're going for an interview or you're going for a difficult competitive exam. Do you know how many times you go to toilet before you go for the exam? That the body is stressed, the mind is anxious. And of course, the body and the mind are connected. So this is why the patient is going to toilet many, many times. Although there is nothing actually wrong with the bowels, nothing organically wrong, but the going to toilet or the not going to toilet, i.e. constipation or the abdominal cramps, where the abdomen is trying to move ineffectively, then that is the expression of the anxiety present in the patient's situation. Most often on talking to the patient and actually going into the background and discussing history and mental health and all of the other things, I can, in about 95% of cases, find that these symptoms are actually connected to a mental health issue. The patient, in most cases, have never thought of it like this. They were thinking there's something wrong with my bowels. But the body is not made of watertight compartments. The body is all one, and all the symptoms influence and affect each other. So what we have to do next is we have to take a thorough history, do an examination of the patient abdomen, including examination of the back passage, get an ultrasound scan, an X-ray if we are worried about constipation as to what level of fecal loading is there. And also, we need to do quite a few blood tests to make sure that the patient does not have anything serious underlying that is giving them the bowel symptoms. So we will check for things like Helicobacter, we will check for things like celiac. I usually, along with all the testing that I do, I will usually ask for a food diary for a month, and then I sit down with the patient a month later, study the food diary, and then we can discover things like the patient can have boiled or cooked tomatoes, but they can't have raw tomatoes in a salad. So when they have raw tomato, the stomach reacts. So we don't know why the stomach reacts to the raw tomato, but we think it might be something that the body has developed an intolerance to. So the patient is then advised to avoid raw tomatoes but have cooked tomatoes because there is no problem with that. The other side of IBS is if I were to speak to the patient and I were to find that there was serious mental health issues in the background, I would then start off with the mental health issues, organize counseling or therapy as required, and that usually helps the bowel symptoms a lot. Of course, we will have to do the blood test and the scan and everything else for the bowels, and we'll also have to treat the mental health side of things, and together the two systems will make each other better. We can never say without testing that the patient has IBS. We will have to check every test to make sure that the patient does not have anything more serious, and only when all the tests have come back clear that we can say that, right, this patient has had all the testing, everything's clear, therefore they have IBS. If you have any questions, please don't hesitate to put them in the box down below and I'll answer them. Thank you.